Welcome to the Health Awareness Podcast, your reliable companion for evidence-based health knowledge and wellness guide. Our goal is to keep you informed, supported, and empowered on your journey to better health. For links, updates, and additional resources, please check the description.
Welcome back to the Health Awareness Podcast, everyone. I'm Jenny, and I'm so glad you could join us today.
And I'm Dr. Mark. We're really happy to have you here, because today we're tackling a topic that's incredibly important, but often goes unnoticed until it's quite advanced: chronic kidney disease, or CKD.
That's right, Mark. CKD is often called a silent killer because it can progress for years without any obvious symptoms. People might not even know their kidneys are in trouble until the disease has reached a serious stage. It's truly a scary thought.
It is, Jenny, and that's exactly why awareness is so crucial. The early signs can be subtle, easy to dismiss, or mistaken for other common ailments. But catching CKD early can make a world of difference in managing it and even preventing it from getting worse.
Absolutely. So today we're going to break down everything you need to know in a really simple, practical way. We'll talk about what your kidneys actually do, what CKD is, those all-important early signs you mustn't ignore, the major causes and risk factors, how it's diagnosed, and what treatment options are available. Plus, we'll share some fantastic lifestyle changes to protect your kidneys and prevent kidney failure. It's going to be a comprehensive and really important episode.
Let's dive right in then. Jenny, I think a great place to start is by understanding what our kidneys actually do. Most people know they're important, but might not grasp the full scope of their work.
Exactly. So picture this. Your kidneys are like your body's super efficient filtration system. Think of them like the water filter in your home, but for your blood. You have two of them located just below your rib cage on either side of your spine, and they work tirelessly 24/7.
That's a perfect analogy, Jenny. They filter about 120 to 150 quarts of blood every single day. And what they're doing is removing waste products, toxins, and excess water to produce urine. If these waste products built up, they would literally poison us.
It's incredible, isn't it? Beyond just filtering, they also play a huge role in balancing the water in your body. If you drink too much, they get rid of the extra. If you're a bit dehydrated, they conserve it. It's a precise balancing act.
And it's not just water. They're also crucial for balancing essential salts and minerals, like sodium, potassium, calcium, and phosphate. These minerals are vital for everything from nerve function to strong bones. Too much or too little of any of them can cause serious health problems.
They even help control your blood pressure, right? I know they produce hormones that tell your body whether to raise or lower it, which is pretty mind-blowing.
Absolutely. They produce a hormone called renin, which helps regulate blood pressure. And another hormone, erythropoietin, or EPO, which tells your bone marrow to make red blood cells. Without enough red blood cells, you get anemia, which causes fatigue and weakness.
So basically, they're multitaskers, doing everything from cleaning your blood to managing your blood pressure and even helping produce red blood cells. They're definitely crucial. You really can't underestimate their importance.
You really can't. And when something goes wrong with these amazing organs, that's where chronic kidney disease comes in. So let's talk about what CKD actually is. Simply put, it's a condition where your kidneys are slowly and progressively damaged over time.
So it's not like a sudden event like a heart attack, but more of a gradual decline, right? I know some people get confused between acute kidney failure and chronic kidney disease.
That's a great point. Acute kidney failure happens suddenly, often due to an injury, severe infection, or certain medications, and it can sometimes be reversed. Chronic kidney disease, on the other hand, develops slowly, usually over months or even years. It's a long-term problem where the damage accumulates, and unfortunately, it's often permanent and progressive. We talk about CKD in stages, from mild damage in stage 1 to very severe kidney failure in stage 5.
And the scary part, like we mentioned, is that you might not feel sick until you're in those later stages, which brings us back to why early detection is so critical, doesn't it?
Exactly. The earlier we can identify it, the better chance we have to slow its progression, manage the symptoms, and prevent serious complications. Many people don't realize they have it until their kidney function is already significantly reduced. That's why knowing the early signs is so incredibly important.
So let's get into those early signs of CKD. This is really the heart of our episode today. Mark, what's one of the first things people might notice?
Well, a very common early sign is swelling, especially in your feet, ankles, or around your eyes. This is called edema. When your kidneys aren't working properly, they can't remove excess sodium and water from your body, so that fluid starts to build up in your tissues. You might notice your shoes feel tighter, or your rings are harder to get off.
That makes sense. Another sign people might notice is a change in their urine, right? Like foamy or bubbly urine.
Yes, absolutely. Foamy or bubbly urine, particularly if it persists, can be a sign that there's protein in your urine. Your kidneys are supposed to keep protein in your blood, but if their filters are damaged, protein can leak out into your urine. Think of it like a coffee machine with a faulty filter letting grounds into your cup. Similarly, you might notice dark or tea-colored urine, which could indicate blood in the urine, another red flag.
What about feeling really tired all the time? I know that's a common complaint for a lot of things, but it can be a sign of CKD too, can't it?
You hit on a big one, Jenny. Persistent fatigue or feeling unusually tired even after enough rest is a major symptom. Remember how I said kidneys help produce red blood cells? When kidneys fail, they produce less of that hormone EPO, leading to anemia. Plus, the buildup of toxins in your blood can just make you feel generally unwell and exhausted. This fatigue can also lead to trouble concentrating or brain fog because those toxins are affecting your brain function.
Wow, so it affects your energy and your mental clarity. What about pain? Could back pain be related?
It can be, yes. Dull, persistent pain in the side or lower back, where your kidneys are located, can sometimes be a symptom. It's not always kidney-related, of course, but if it's unexplained and accompanies other symptoms, it's worth investigating.
Any changes in how much you're urinating, like less than usual or more often at night?
Absolutely. A reduced urine output can indicate your kidneys aren't filtering as much as they should. Conversely, some people with early kidney damage experience more frequent urination, especially at night, a symptom called nocturia. It's almost like the kidneys are working overtime in a less efficient way trying to get rid of fluids.
I see. And what about things like nausea or changes in taste? Those seem less directly related to kidneys.
They might seem less direct, but they are indeed signs. The buildup of waste products in your blood can cause nausea, vomiting, and a general loss of appetite. Some people also report a metallic taste in their mouth, which is another result of those accumulating toxins affecting your taste buds. Imagine never quite feeling hungry and everything tasting a bit off. It can severely impact quality of life.
That's truly awful. And I've heard about itchy skin being a symptom too. Is that true?
It is. Severe, persistent itchy skin can be a sign of advanced kidney disease. This happens because the kidneys can't remove all the waste products and mineral imbalances, like high phosphate levels, which can accumulate in your blood and lead to intense itching.
So to recap, if you're experiencing persistent swelling, changes in urine, chronic fatigue, trouble concentrating, unexplained back pain, reduced or frequent night urination, nausea, a metallic taste, or itchy skin, these are definitely things to pay attention to and get checked out by your doctor.
Precisely. Now let's shift our focus to the why. What are the major causes and risk factors that lead to CKD?
This is crucial because many of these factors are things we can actually control or manage. What's the number one cause, Mark?
Hands down, the number one cause of CKD is diabetes. High blood sugar levels, over time, damage the tiny blood vessels and filtering units within the kidneys. It's like constantly running too much pressure through a delicate filter system. Eventually, it breaks down. About 1 in 3 adults with diabetes also has CKD.
That's a really high number. So managing blood sugar for diabetics isn't just about avoiding things like nerve damage or vision loss, it's also critical for kidney health.
Absolutely. Following closely behind diabetes is high blood pressure, or hypertension. Uncontrolled high blood pressure puts a lot of strain on the small blood vessels in your kidneys, causing them to narrow, weaken, or harden over time. This makes it harder for the kidneys to do their job, leading to kidney damage. It's like a garden hose bursting if the water pressure is too high for too long.
So people with high blood pressure really need to keep an eye on that. Are there other risk factors that might surprise people?
Definitely. Family history plays a role. If someone in your family has CKD, your risk might be higher. Smoking is another big one. It narrows blood vessels throughout your body, including your kidneys, and can also worsen high blood pressure. Obesity is also a major risk factor, as it's often linked to both diabetes and high blood pressure.
And diet too, right? Like a high-salt diet.
Spot on, Jenny. A diet high in salt contributes to high blood pressure, which in turn stresses the kidneys. Also, the misuse of certain over-the-counter painkillers, like NSAIDs, think ibuprofen or naproxen, can cause kidney damage if taken too often or in high doses. People might take them daily for chronic pain without realizing the cumulative effect on their kidneys.
That's a really important point. Many people don't consider the long-term impact of those common pain relievers. What about something as simple as dehydration?
Prolonged or severe dehydration can definitely stress the kidneys. They need enough fluid to do their job efficiently. And then there are infections. Untreated urinary tract infections, or UTIs, that spread to the kidneys can cause damage. Also, certain kidney infections themselves, if recurrent or severe.
And I suppose as we get older, our kidneys naturally start to wear down a bit too, don't they?
Exactly. Aging is a natural risk factor. Our kidney function can decline somewhat as we get older, so regular checkups become even more important for older adults. The key takeaway here is that many of these risk factors are interconnected and can compound the damage.
So if someone is experiencing some of these early signs or has these risk factors, how do doctors actually diagnose CKD?
It's usually a straightforward process with simple tests. The most common are basic kidney function tests, which involve a blood sample. We look at something called creatinine.
Creatinine? What exactly is that?
Creatinine is a waste product from normal muscle activity. Healthy kidneys filter it out of your blood. If your kidneys aren't working well, creatinine builds up in your blood, so a high level is a sign of kidney problems. From that creatinine level, we can calculate something called your eGFR, or estimated glomerular filtration rate.
The eGFR, that sounds important.
It really is. The eGFR is the best measure of kidney function. It tells us how well your kidneys are filtering your blood. It's essentially a percentage, and it's how we determine the stage of CKD. Another key test is a urine protein test. We look for albumin, a type of protein in your urine. As we discussed, healthy kidneys keep protein in your blood, so finding it in your urine can be an early sign of kidney damage.
So, blood tests for creatinine and eGFR, and a urine test for protein. Are there any other tests?
Sometimes, if there's a need to look at the physical structure of the kidneys, a kidney ultrasound might be done. This can show if there are any blockages, cysts, or abnormalities in the kidney's size or shape. But for most cases, the blood and urine tests are usually enough to diagnose CKD.
And that's why regular checkups, especially if you have risk factors like diabetes or high blood pressure, are so vital even if you feel fine, right?
Exactly. These tests can catch CKD long before symptoms appear, giving you and your doctor a head start on managing the condition. Moving on, once CKD is diagnosed, what are the treatment options?
The good news is that there are many ways to manage CKD and slow its progression, especially in the early stages. The first step often involves controlling the underlying causes.
Yes, for example, if diabetes is the cause, meticulously controlling blood sugar levels is paramount. This means careful diet management, regular monitoring, and taking prescribed medications like insulin. Similarly, if high blood pressure is the culprit, controlling it through medication and lifestyle changes is key. These aren't just treating the symptoms, they're protecting the kidneys directly.
And diet plays a huge role here too, especially a low-salt diet, I imagine?
Absolutely. Reducing sodium intake helps control blood pressure and reduces the fluid retention that stresses the kidneys. Your doctor might also prescribe specific medications. For example, ACE inhibitors and ARBs are a class of blood pressure medicines that are particularly good at protecting the kidneys, even if your blood pressure isn't extremely high.
Oh, that's interesting. So they're not just for blood pressure, they have a direct kidney protective effect.
That's right. They help relax blood vessels and reduce pressure within the kidney filters themselves. Also, treating any infections, especially UTIs, promptly and completely is vital to prevent further kidney damage. And of course, avoiding drugs that harm the kidneys, like excessive NSAIDs, is a must.
What happens if the disease progresses to the very late stages despite all these measures?
In very advanced stages, when kidney function drops to a critical level, the kidneys can no longer keep up with removing waste and fluid. At that point, life-sustaining treatments like dialysis or a kidney transplant become necessary. Dialysis is a procedure that artificially filters the blood, essentially doing the job your kidneys can no longer do. A kidney transplant replaces a failing kidney with a healthy one from a donor. But the goal, always, is to prevent reaching that point through early detection and management.
That makes total sense. So let's talk about some natural lifestyle changes everyone can make to protect their kidneys. These are practical tips anyone can apply.
Definitely. Number 1. Drink enough water. Staying well hydrated helps your kidneys flush out waste. However, if you already have advanced CKD, your doctor might advise limiting fluid intake, so always check with them.
That's a good distinction. And reducing sodium, as we mentioned, is super important.
Yes, aim for less processed foods, and check food labels for sodium content. Also, be mindful of excessive protein intake. While protein is essential, a very high protein diet can put extra strain on the kidneys. It's about balance. And related to that, reducing red meat consumption and opting for more plant-based proteins or lean meats can be beneficial.
So basically, a healthy, balanced diet rich in fruits and vegetables, which also helps control blood pressure and blood sugar.
Precisely. And of course, quit smoking. We can't say it enough. Smoking is detrimental to almost every organ in your body, including your kidneys. Manage stress effectively too. Chronic stress can impact blood pressure, which as we know is bad for kidneys. Exercise regularly, even moderate physical activity, like a brisk walk for 30 minutes most days, can help maintain a healthy weight, control blood pressure and blood sugar.
All those good habits we always talk about seem to apply across the board, don't they? And maintaining a healthy weight goes hand in hand with that.
They truly do. Finally, and I want to reiterate this, limit painkillers like ibuprofen. Use them only when necessary and strictly follow the dosage instructions. Don't take them for prolonged periods without consulting your doctor.
That's a fantastic list of actionable steps. Now, let's wrap this up with some very clear habits to prevent kidney failure overall. What should our listeners take away as their absolute top priorities?
Okay, top priorities for prevention. First, check your blood pressure regularly. Whether at home or at the doctor's office, know your numbers. Second, monitor your sugar levels, especially if you have diabetes or pre-diabetes. Early control is everything. Third, if you have risk factors, ask your doctor for an annual kidney test. Those simple blood and urine tests can literally save your kidneys.
So important. And what about daily habits?
Reduce alcohol intake to moderate levels, if you drink at all. Stay consistently hydrated throughout the day. And don't ignore UTIs or any other infections. Treat them early to prevent them from spreading and causing kidney damage. These simple habits really make a huge difference in the long run.
All right, so to sum up for our listeners today, here are our key takeaways about chronic kidney disease. 1. CKD is often silent, progressing without obvious symptoms until later stages, making early awareness critical. 2. Swelling, foamy urine, persistent fatigue, and unexplained back pain are vital early signs that warrant a doctor's visit. 3. Diabetes and high blood pressure are the leading causes, so managing these conditions is paramount for kidney health. 4. Simple blood and urine tests can diagnose CKD early, often before symptoms even appear, so regular checkups are crucial, especially for those at risk. And 5. Lifestyle changes like managing diet, staying hydrated, exercising, and avoiding smoking and NSAID misuse can significantly protect your kidneys.
That's a perfect summary, Jenny. Our kidneys do so much for us, and it's essential we take care of them. Don't wait for obvious symptoms. If you have risk factors or notice any of the early signs we discussed, please talk to your doctor.
Thank you so much for tuning into the Health Awareness Podcast today. This was a really important conversation, and we hope you found it helpful and empowering. If you know someone who could benefit from this information, please share this episode with them.
And don't forget to subscribe to our podcast wherever you listen so you don't miss future episodes. Next time, we'll be discussing another vital topic: heart failure, its causes, symptoms, and practical lifestyle fixes. You won't want to miss it.
Thanks again for joining us, and until next time, stay healthy and stay informed.
Take care, everyone.